Stay tuned to discover the role of neurogenic tremoring for pain resolution. Hi there, I'm Dr. Krista Burns, founder of the American Posture Institute and your host for the Pain Summit. The Pain Summit is dedicated to empowering you with the knowledge, hope, and proven solutions to overcome chronic pain. I'm honored to welcome our next guest expert. Alex Greene is an expert in structural integration bodywork, somatic experiencing, the Feldenkrais method, and TRE, tension and trauma releasing exercises. He has pioneered the use of the therapeutic neurogenic tremor reflex for nervous system regulation and pain management. He's the co-founder of Neurogenic Integration, an online educational platform dedicated to doing increasing and spreading knowledge of the neurogenic tremor reflex. Today he'll be sharing with us neurogenic tremoring for pain relief. Alex, thank you so much for joining us as a speaker on the Pain Summit. Please take it away.
Well, hello, everybody. So glad to join the Pain Summit here today. My name is Alex Greene, and I am based in Boulder, Colorado. And I'm going to be talking today about the use of neurogenic tremoring for pain relief. And I'll define what neurogenic tremoring means here in a few moments. But let me tell you just a little bit about my own professional background and then how I work with some methods to work with chronic pain. So again, my name is Alex Greene, and my training is across several different domains. My original professional training is in structural integration manual therapy, which I still practice currently. And then in addition, I have training in nervous system-based approaches. That to me, that's what all of these other ones have in common. So TRE, tension and trauma releasing exercises, is a modality that works with the neurogenic tremor response. That's primarily what we'll be discussing here today. Somatic experiencing is a autonomic nervous system model developed by Dr. Peter Levine, often utilized in trauma and stress regulation, but also with chronic pain applications as well. And then the Feldenkrais method of somatic education is a movement-based approach for neuromuscular refinement and oftentimes with pain resolution as part of its emphasis. And then I'm the co-founder of a new project in addition to my private practice, which I'm not describing here, but in my the newest effort is in a sense, an institute about educational learning, specifically about the neurogenic tremor response and how it has broad applicability in lots of different domains. And so that's a big focus of my professional work right now. So just to share a little bit how I discovered neurogenic tremoring and why it caught my attention, and then in many ways has woven through my clinical career. So rewinding the tape about 20 years, I was living in Honolulu, Hawaii, and I had a stubborn and persistent pain issue in my hip and low back and a sciatica pain complication, and it was interfering with my meditation. And I was very into seated meditation in that era. And so I was perplexed by this problem, and I tried lots of approaches to see if I could get some resolution. And at one point, I went through the 10 session series of structural integration bodywork developed by Dr. Ida Rolf, which is a sort of a comprehensive way of working with the myofascial system and postural alignment to improve function and well-being. And I went through it sort of on a weekly basis over a 10-week period. And during the third session of this work, where the bodywork practitioner was doing some work in my upper rib cage and where it meets the axilla and a little bit sensitive area. And I was on my back, and the positioning that we use in this style of structural integration is when we're on our back, our knees are bent up with the back flat. And as I was kind of breathing into the sensation from this body work, I felt a tremor and a quiver start to arise in my legs and my knees. And I kind of looked at my bodywork therapist, and she said, "That's fine, go ahead, just allow that to happen. That happens, it's a release." So I was a bit surprised, but I relaxed into it. And when I did, a big cascade of neurogenic tremoring, where I didn't actually, I wouldn't have used that word at the time, but spontaneous shaking arose that included my legs and my hips. And it didn't feel out of control. It felt like I could have stopped it if I wanted it to, but it was as though my body really needed to have this big tremoring discharge experience. Lasted about 10 or 15 minutes. And when I was done, with that, when that settled, and then later when I came to standing, I had felt a significant shift in the default orientation of my pelvic alignment, which was one of the big goals we were working with structurally. And my whole pain complex didn't end fully at that moment, but I credit that as a significant portion that then led to a resolution of that pain issue that I was having at that time. So anyway, I was sold. So I didn't know what that shaking was, and the bodywork therapist didn't know what it was, other than that it would happen sometimes, and it's okay that that happens. That was the extent of it. I was sold enough on the powers of structural integration that I later on, several years later, went through the training and that embarked upon a career as a structural integration bodyworker. And during my work working with clients, I would often see similar versions of what had happened to me, either sort of very full blown tremoring experiences, similar to how I would describe mine, or more subtle versions where a limb or something was indicating some kind of vibratory pattern that the person definitely wasn't consciously doing. It was something arising seemingly from the nervous system. Now, at that time, I didn't really have any nervous system training, and it wasn't a part of the structural integration curriculum. So again, missing sort of an explanation as to what this process might be about. As luck would have it, a colleague of mine kept telling me I needed to try this TRE thing. I didn't know what it was. I was saturated by acronyms. I wasn't even curious to learn what that was. But she was going through her training to become certified as a TRE provider. And so I volunteered to be a guinea pig, not knowing anything about what I was going to be doing. And she guided me through a process verbally, which I'll show here in this presentation a little bit later. In a few minutes, you can see what this process looked like. But I was laying on my back and I was guided through a set of movements that stimulated almost duplicated the kind of shaking tremoring experience that I had had when on the bodywork table. And it was very similar. It was a high vibration of movement, and it lasted for about 10 or 15 minutes. It brought things to completion. And I was so excited because it was answering a question I had been holding for at least a decade, which was, what was that? And it feels important. What do we know about that? And I realized that somebody else had knew about this, had studied it, and created a system uh, to elicit this tremor response, not just waiting for the stars to align, but for a methodology of inviting this reflex, and knew about the neurobiology and all of that. So that became a major, a key moment in my career, because I was introduced to the work of this gentleman here, Dr. David Berselli, based in Phoenix, Arizona. He's the developer of TRE, tension and trauma releasing exercises. And um, and I was fortunate to go through the professional training soon after I learned about it, and began incorporating into my work as a structural integration bodywork therapist. But just briefly about Dr. Berselli and the development of this methodology. Dr. Berselli had an interesting career as what's called a field traumatologist. And what that meant is that he was working primarily overseas, working in conflict areas and natural disaster relief zones. And he had a kind of a diverse training, both as a clinical social worker, but also with body work education and bioenergetics training as part of his background. And he made some really interesting observations when he was embedded in the sites where he was, which was that during high stressful situations like bombs going off, mortar shells, things like that, organically people would have a tremoring response, especially children, more often children, but to some extent the adults. And as he discussed it with people, everybody had the same common description, which was when I feel that, I try to stop it if I can, so that no one else knows that I'm afraid. And he had that same experience himself. And he began to question, is the tremoring that arises in those kinds of high intensity situations, is it just a random side effect of biology that has no particular meaning? Or could it actually be a reflex mechanism that has a biological function and purpose? Could the reason be that we go through a tremoring under those high stress scenarios? Could there be something important happening, like the downregulation of the nervous system, or the dissipation of stress hormones, et cetera, et cetera? So that began a quest for him to learn as much as he possibly could what was known about this phenomenon. And it turns out not a lot is known in the medical literature. Tremoring is understood most often as a pathological component, as a component of essential tremor, or as a diagnostic criterion for general anxiety disorder. So most commonly, it's seen as, again, sort of a pathological side effect or symptom of something else going on. But a few people in the fields of trauma therapy were seeing similar things, where tremoring processes were an important component of trauma resolution. And so a key pioneer is Peter Levine, who I mentioned earlier, a developer of somatic experiencing, but also people in some of the other body-based or bottom-up trauma fields like EMDR and brain spotting, were also similarly describing that during when working with people with acute stress, PTSD, and trauma, it was very, very common to go through a phase of this kind of a discharge. And it seemed very important in the resolution of the symptoms for the people. So, and one of Peter Levine's key insights that Dr. Berselli looked into was that biologists who study animals in the wild, the field of ethology, studying animal behavior, had ample examples, especially in predator-prey environments, where prey animals who are almost eaten by a predator, but through whatever circumstances, the predator is deterred. The common observation that that the animals who had nearly been killed often were in what's called a freeze, immobilization, collapse state, what we sometimes think of in animals as sort of playing dead or playing possum, as the phrase goes. But that then, when the danger was past, after a period of time, spontaneous breaths would emerge for the animal, and then a quivering and a shaking and a discharge process that looks essentially identical to the way that it happens in human beings. So it's good evidence that supporting Dr. Berselli's hypothesis that maybe there's a biological importance to this. And what's interesting in animal studies is that animals who are under those kinds of intense threat situations, they do not display symptoms of PTSD or reduced stress resilience. And the theory is that because they carry their biological process to completion, which includes this physiological discharge through tremoring, therefore, in a sense, they get a nervous system reset, and are not carrying the imprint of stress or trauma in the same way that human beings typically do. So, so that's that. So just a few things that we know about neurogenic tremoring as a methodology. What Dr. Berselli's key insight was, besides that, the importance of tremoring, he then developed a way of inviting it, not using. We don't do it in the context of big stresses or things like that. The key differentiator is that he developed a physical way of accessing the same reflex, the neurogenic tremor reflex, not in a stressful environment, but in the context of safety. And he developed a system that could be done both one-on-one as sort of individual facilitation, or with groups, small groups, and something that people could learn independently, continue it on their own, or when he was leaving an area that he was working with, groups would form that they could continue this practice as needed, which was very helpful sort of culturally. He was sometimes in settings where doing a lot of one-on-one psychotherapy work was not going to be well received. Um, so what we have learned about tremoring in the few decades since Dr. Berselli's developing of the method is that yes, it seems to have a significant influence both neurophysiologically, meaning a big influence on the autonomic nervous system. What it seems to do is help the nervous system transition from stress physiology, like the fight or flight sympathetic nervous system, or the freeze dorsal parasympathetic state, helps it transition back into homeostatic safety physiology. So that's kind of on the nervous system side. And on the muscular side, because tremoring is it's mechanical, it has a mechanical component. When we initiate it, it begins in the legs, but then as a person learns to relax, it actually becomes a full body. It moves through the spine. It resolves tension in the neck, the shoulders. Sometimes tremoring can move into somebody's jaw. In a way, it follows the myofascial meridians or the pathways through the body. And so at the muscular skeletal level, what tremoring seems to be doing when we engage with it as a practice, meaning repeatedly, is it creates a letting go of chronic tension patterns that might be associated with stress or injury or whatever the case may be. So again, we have both this nervous system benefit associated with it, as well as the musculoskeletal integration kind of component. In my work, I do a hybrid of working with the tremor response as well as the manual therapy that I do with structural integration or the movement therapy that I do with Feldenkrais work. And in my practice, I'm kind of equally divided between in-person clientele, where obviously I can be hands-on, and equally divided with people that I work with remotely. In that situation, I obviously can't be doing structural integration, but fortunately, what I like so much about this methodology is that we can work with it hands-on or hands-off and still get significant benefit. In terms of the kinds of pain that I work with or that can be well connected to through neurogenic tremoring is kind of the gamut of pain responses. So some of on the left side here, these are things more associated with postural dysfunctions, chronic bracing patterns. These might be the results of injuries or strain or long-standing postural issues. So these are kind of this category. But other aspects of chronic pain can be a little bit more nervous system based, fibromyalgia, irritable bowel syndrome, whiplash syndrome post car accident or associated with chronic stress or PTSD. And so I work kind of with both categories of pain, and I see good results when I incorporate neurogenic tremoring uh, into that process. Um, and so so briefly, kind of the course of work that I do when I work with people, again, whether this is in person or online, is after I understand somebody's kind of subjective history with pain and how it presents, and I do a little bit of postural or movement assessment to see how they're moving and the alignment is in their body. Then I teach the person how to induce this neurogenic tremor reflex, which we're going to see in a video here in a moment. And the and in the beginning, we're just working with it for a minute or two because we're seeing how the person receives it. For some people, we start the tremor reflex and it's like, oh, this feels so good. I've been waiting for this to happen. Other people, there's more hesitation. There's some concern, or it feels, could be potentially overwhelming. Most people find it to be quite safe and regulating, but our approach in general is to introduce it first, make sure it's well digested by the person and their nervous system, and then to build up as we sort of observe the cause and effect of, if we did 3 minutes of tremoring, then perhaps the next time we might do 5 minutes, for example. And then I kind of I both guide people to structure their own practices. In addition to working with me, I want people to graduate from working with me to having an independent practice. They still might do facilitated work here and there. They might join classes as a way to continue their so they're not alone with their practice if they'd rather be in sort of a group. But again, a big emphasis is to get people doing this independently. But because I am a bodywork therapist, I often do co uh, uh, use also my myofascial work or structural integration work in combination, which is effective because I can address trigger points and stress patterns manually, and then work with the tremor process to create integration and release. I love being able to work inside out. That's what the tremoring is. It's coming from within the person's organism. And then as the manual therapist, it's sort of me connecting from the outside in. And I find that to be a very useful thing. So let me show the process a little bit as our so viewers can just have a preview in a human being. I don't have an animal video to show you here today, but this is my colleague Siv. She's a chiropractor based in Norway, and she is my collaborator on the neurogenic integration project. So in this session, so first she's laying flat. This is sort of like in yoga. We're simply relaxing. We often will invite sort of a body scan and a relaxation process before we try to bring in the neurogenic tremor process, make sure people are feeling safe and regulated, et cetera. And then she's coming up to a position here that we have alternate positions when this is not appropriate. But here I call this the open butterfly position or the open diamond shape. It has a term in yoga too. But in essence, what we're doing here is creating a stretch through the inner thigh adductor muscles, and then I'm going to skip ahead a little bit. She is raising her hips and pelvis for about a minute or two. And if you can watch carefully, she's not totally stable here because this is a little challenging to the neuromuscular system. We're starting to see a little rocking. And so this is the beginning of waking up a tremor reflex. And then she'll return to sort of resting into this open diamond shape. And then where we are really starting to create this vibration is incrementally. Steve is bringing her knees together and then a little bit further, going through a range of motion where she's closing her knees as though closing the covers of a book. And as she goes up notch by notch with some time at each of those notches, we're going to start to see that it's waking up a reflex. Now, she could stop it, she could bring her legs long. Many of you watching have probably had something a little similar happen when you're exercising or doing yoga, or many of us know that when we have engaged our muscles. The difference with a neurogenic tremoring practice is once we wake it up, instead of then just doing something else, we relax into it and see where it goes. So here now, her feet are flat and she's in what we would call the tremoring position. And normally, if you laid on your back in this position, not much would be happening. But because we have woken up this neurogenic tremor reflex, we are starting to see. So she's not intentionally doing these movements, she's allowing this reflex pattern. And a lot of the oomph of tremoring comes from first the inner thigh muscles, but it's very good at addressing core tension in the iliopsoas group or our deep hip flexors. So that's one of the main drive. Many of us carry chronic tension in the psoas as well as other places. And so as it starts to let go, we begin to see the kinds of movements. And as we see with Sieve here, even though the movement began in her legs, we see some undulatory movement coming up through the spine and rib cage as she's allowing it to move more systemically. So just to, in closing, so that's just a quick preview of sort of what the practice itself looks like. You can learn independently, very much so. In fact, I'll point you to a resource where of a easy video course we've created just to get people started, but you can work with practitioners one-on-one is another good way to start. and to get if somebody is curious about trying this method. The kinds of outcomes that we see are on the nervous system level, people feeling less stressed, more regulated. From a musculoskeletal perspective, improved posture, freer movement, more functional body mechanics, a reduction in pain, sleep improvements, and in general, greater stress resilience. And just as a closing slide, how to learn more on our website, neurogenicintegration.com, is a good place if you wanted to get a little bit more education about this methodology or to contact us directly. Traumaprevention.com/research is a site where a lot of the growing body of research studies around the use of this in different settings is showing up. We're on social media, especially Instagram here, and this would be my email address if anybody's curious to reach out directly.
Wonderful. Alex, thank you so much for this excellent presentation. Thank you for, enlightening us with this neurogenic tremoring. I'm going to go through a summary and then a couple of questions for you. You talked about your personal journey of feeling the benefits of spontaneous shaking as a release, felt a significant shift in the default alignment of your pelvis, which led to the resolution of pain. And then fast forward, discovering TRE, guided set of movements for tremoring at a high vibration movement. So the purpose of TRE then is to elicit or invite the trembling reflex. And so that's tension and trauma releasing exercises, a series of 7 exercises designed to fatigue muscle groups, especially the psoas and the leg muscles, to intentionally invoke involuntary shaking or tremors. These tremors are neurogenic tremors, the body's natural stress releasing mechanism. So the reflex has a biological purpose to downregulate the nervous system. With neurogenic tremoring in nature, we see this with animals. So shaking after a life-threatening event is an instinctive way to discharge fear and return to equilibrium. So animals will tremble after escaping a predator, for example, and they're literally shaking off the trauma. Now, with stress reduction and autonomic nervous system modulation, so tremoring engages the body's relaxation response. The involuntary tremors activate the parasympathetic nervous system for rest and digest and quiets the overactive sympathetic nervous system, which so many of us need. Tremoring discharges excess adrenaline and muscle tension, leading to a calmer physiologic state. And from a polyvagal perspective, helps the body transition back to a safety physiology. With muscle tension release, it helps relax chronically tight muscle fibers. Its vibrational therapy shows that low frequency muscle vibration increases blood flow. And then tremoring for pain syndromes, things like postural dysfunction, low back pain, neck pain, shoulder pain, sciatica, pelvic pain, headaches, IBS, fibromyalgia, and whiplash. And with the treatment strategy, so I love how you've broken this down, going through a comprehensive case history, posture and movement assessment, myofascial assessment, inducing the neurogenic tremor reflex, combining tremoring with movement and touch facilitations, guidance for home tremoring practice, as well as co-treatment with manual therapies. You gave us a great video example, and we were able to see the patient lying on her back in an open butterfly position. She lifted her hips and then lowered hips and closed knees with timing, waking up the reflex, and then relaxed into it with flat feet. And we could see that she had relaxed into that neurogenic tremor. It releases tension, especially along the iliopsoas. We were able to see her release, and may have even tremoring up in the upper body as well. So ultimately, the outcomes are a calmer, more grounded nervous system, more fluid movement, improved posture, reduced pain, improved sleep, and greater stress resilience. Alex, I love this. I think this is such an insightful way of helping patients who are struggling with chronic pain. Couple of questions for you. When it comes to the feeling, can you describe how it feels when in the tremor? And do you need to have a tremor in the area of pain, or just tremoring anywhere in the body helps relieve the nervous system? So, for example, if they have shoulder pain, would a shoulder pain patient expect to have tremoring in their shoulder, or would it likely be in the legs and the lower body like we had seen on the video?
Yeah, great question. So, just so to respond to the first one, what does tremoring feel like? So it's, can be a little bit variable per the individual because tremoring can show up at different ranges. So there's both sort of higher amplitude, bigger movements. There's finer movements. Sometimes we might describe tremoring is more high intensity. Sometimes that's associated even with heat in the body. We consider that sort of a sympathetic nervous system discharge, but sometimes it's a mellower feeling or more relaxed feeling. So it kind of can span a spectrum a little bit from a sensation perspective. Most people, when they're new to it, they would say, wow, it's surprising. We hear that word frequently. It's a funny feeling. We hear that frequently. Many people, it's like intuitively, wow, this feels good. There's something really good about this. Other people are a little wary about it, and we just work with that. So because to help people relax into the experience and not introduce anything too quickly. We basically, we don't want there to be any too much resistance to doing the experience. It doesn't help anybody. Um, in terms of the question about does an area with pain need to be directly tremoring? Sometimes yes, and sometimes no. With an example would be, say, fibromyalgia, which is a pain pattern that can show up uh, anywhere in the body, and is not directly linked to, typically not directly linked to a particular musculoskeletal dysfunction, or it's more of a systemic thing. So with something like that, or irritable bowel syndrome or whatnot, because we believe that the benefit is at the autonomic nervous system level. So by helping to discharge and settle, re-regulate the nervous system systemically, then that is then changing the set point of the autonomic nervous system, which is leading to less pain presentation that's sort of driven by stress physiology. So in those situations, it's more of a systemic phenomenon. It doesn't matter exactly where it tremors. Now, if the issue is, say, shoulder pain or lower back pain or pelvic tension, or it's a specific tension pattern, um, there it sort of depends. In a way, we are eventually hoping that tremoring is happening either directly in that region or sort of nearby. Sometimes nearby is enough for there to be a shift in the sort of myofascial tension patterns. Um, we don't try to force any of that to happen. It tends to be something that just organically grows over time. We have to be a little patient sometimes, because let's say I'm trying to resolve a shoulder dysfunction. Somebody shows me how to tremor. Mostly it's a hip pelvis thing. I'm waiting for my shoulder pain to get better. And I'm thinking, well, geez, it's not tremoring up there. So there's two things we can do. One is we can just the idea of patience, or the idea that because we're addressing a whole, that the part in question is going to be influenced even as we're addressing other parts of the whole. On the other hand, this is where the skillful facilitation of a facilitator comes in, either through verbal guidance or through manual therapy. So verbal guidance would be around creating literal movements. I do this drawing from the Feldenkrais style of working, to basically mobilize the joints and the connective tissue in question. As we do the mobilization while tremoring is happening, very often then that invites the tremor process to move and create more integration into the affected area. Similarly, with manual therapy, I could be performing a traction or a tissue. I could be, if there are hypertonic tissues or trigger points, I can be palpating and directly while tremoring is happening. And again, very often the input coming from me as the manual therapist is then speeding up the process of connecting into the neurogenic tremor release that's happening. And so then these two things start to work together.
Wonderful. I love that. I love the idea of having multiple approaches, and I can imagine that combining those therapies and those approaches really has amazing benefits for patients. In fact, as you're tuning in, I want to encourage you to follow Alex and tune into those great resources he has available for you. And as we conclude another powerful session today on the Pain Summit, I'd like to recognize Alex as a true health hero. And to our incredible viewers, I commend your commitment to overcoming pain and prioritizing your health and well-being. I'm Dr. Krista Burns, your host of the Pain Summit. Click below for on-demand summit access, and don't miss the Advanced Chronic Pain Solutions course held exclusively for healthcare professionals to help your patients overcome chronic pain. Stay tuned, and we'll see you in the next Pain Masterclass of the Pain Summit.